Has your child recently been diagnosed with asthma, but you still don't quite understand what it is? Well, let's talk about it a little bit more in depth so you feel more empowered to help your child and which questions to ask of their doctor. The first thing I would like to explain to you is that asthma is a chronic disease. Sometimes the diagnosis is given when it's not quite chronic, and that's for good reason. Say your 1.5-year-old has wheezed multiple times with respiratory illness and requires a daily medicine to prevent that. While that still may not be long-standing enough to be a true diagnosis of asthma, it's better to go ahead and call it asthma so that everyone involved understands that we're handling this the same way. Because children under the age of 2 can wheeze with respiratory illnesses intermittently, meaning sometimes, and not technically have the diagnosis of asthma. But the worst thing we can do is not label it when it's becoming common and frequent, and the parent and other caregivers and providers of medical care don't understand that the child is likely to be wheezing. How we see this play out is in emergency rooms across the country. The parent brings the child in, they have a history of wheezing, they've had this horrible cough, they're now in respiratory distress, and the ER doctor says, "Did you give them any Albuterol?" And they said, "No, they don't have a diagnosis of asthma. We didn't know we were supposed to." So that's why sometimes the diagnosis is given when it's not technically been chronic. But I digress. Let's go back to what asthma actually is. Asthma is an inherent basically defect in the way that the lungs respond to certain triggers. And a trigger is different for everyone. Common triggers for children are going to be infections and they're going to be environmental allergens, so things that they breathe in. And as a child, they're getting 7 to 12 illnesses a year on average, and they're exposed to a lot of environmental triggers. And so those are the two big main triggers of asthma in young children. But the small little air sacs called the alveoli become swollen with the trigger. And when they become swollen, they actually collapse. And when they collapse, there's no air getting exchanged because that's where oxygen is actually added to the bloodstream. So the child starts coughing in order to try to pop open these airways so that we can get blood to the lungs and get more oxygen. The wheezing is the narrowing of those alveoli, and you can hear air going in and out. You can't always hear it with the ear. You can hear it when you listen with a stethoscope through the actual chest wall, because this is more lower airway and tiny, tiny little air sacs. So when the child is coughing, it's a cough that is for a reason, and we don't want to ignore it. We always tell you what coughs are no big deal unless they have asthma, and they're coughing because they need to open their airways so that they can get oxygen to their blood. The first treatment for asthma is going to be albuterol, or a beta agonist. And those are medications that relax the muscle around those air sacs so that the air sacs can't collapse as easier. So it allows the lungs to open up a little bit despite the fact that they're still swollen. So the swelling is all still there, but the air goes in and out easier so that the child can have more of a comfortable breathing as well as exchange oxygen, which is what's most important. It only works for about an hour. So the biggest complaint I get from parents is, well, I keep having to use it. Yes, that's the whole idea. We use it on average every 4 to 6 hours because of the way that the medication works, but its actual effect is only about an hour in some cases. The second line of medications that we use addresses that swelling. So those are going to be either oral, injectable, or inhaled or breathed in steroids. And steroids are medications that decrease inflammation or swelling. And so when that is given directly to the lungs, the swelling relaxes, air can move in and out, and the medication like albuterol is going to work better and last longer. So again, this is some basics to asthma, but I think it helps for you to truly understand how it works and why your doctor is prescribing the medications that they are and how they work. I'll do a part 2 where we talk about asthma action plans, when to use these different medications, and signs to go to the doctor. Take care.